Getting a gallbladder removed, a tracheotomy, there are procedures most American patients can expect to be taken care of quickly. But imagine waiting as long as 20 years to get them done.
Well, that's what some people living in Guatemala have to endure. But some healthcare workers from Madison have been providing some relief traveling there on mission trips. Armand Rahman caught up with two SSM Health nurses before they embark on one of those life-saving trips this weekend. Armand?
Eric and Susan, according to U.S. government data, 35% of Guatemala's population lacks basic health and nutrition services. So these two RNs I talked to are part of a team seeing patients that travel up to 10 hours by bus to get surgeries that otherwise wouldn't be available to them.
It was really eye-opening the first year I went.
One woman Becky Meinholz treated in Guatemala last year still sticks with her.
You know, it still gives me goosebumps, you know, because you don't think about that when you're here. You know, people will come to the ER with a gallbladder and they get it out that same day. And she lived through life for 20 years, you know, waiting to get this gallbladder out.
She and Lauren Mahoon are circulating nurses at SSM Health who travel to the country with the sole desire of wanting to help.
I do take a week of my own vacation and I pay for this trip myself.
But it's far from a vacation. The team of healthcare workers perform 15 to 20 surgeries a day for 4 days.
We have a motto when we're there. It's adapt and overcome.
What we may take for granted as bare necessities are rare luxuries there.
Like having pillows on our beds or having ice packs that we can fill. They don't have those very basic necessities, so you have to kind of troubleshoot and be creative in the ways that you take care of them, and it's so nice to see that they are so thankful for the basics.
With interpreters on hand, language isn't a huge barrier, but they've picked up a thing or two.
Un poquito español.
We do both know basics, some medical Spanish.
Lauren met a man in his 20s who was attacked, had his throat slit, and needed to replace his breathing tube to continue providing for his family.
So at his young age, he was having difficulty even walking up and down the stairs, and it was just such an experience to know that he could just be able to breathe.
When patients breathe sighs of relief, it reinvigorates Becky and Lauren, too.
It fills our bucket for the year. It really does. Brings us back to what nursing's all about.
And the team leaves Saturday morning and will set up the hospital and start triaging on Sunday. News 3 Now is helping them document this trip and will bring you exclusive updates in the morning and on Live at 4 starting on Monday.
Look forward to hearing more. Armand, thank you.